We were the first county to start Narcan, and that became when I became prosecutor, I could see that by the summertime that we were going to double the death rate. Back in 2012, roughly 60 people had passed as a result of overdosing from opiates. But in 2013, the number was rising and did rise to 112. So as a result, to eliminate the death rate, we turned to Narcan, naloxone, and that we allowed the police to be able to, they were usually the first on the scene, to be able to administer that medication, and to administer that drug. And as a result, our death rate did fall the following year. The next program that we did was to capture them in the emergency room and to get them into treatment, and that was the OR program, the Opiate Overdose Response Program. And that means when somebody was brought into the hospital after being sprayed with Narcan, that a recovery coach would come out, try to assist them, try to convince them to get into detox, to get into treatment, and to follow their progress through the system. And then once we did that, the next program that evolved from it was the Blue Heart program, meaning that now you didn't just have to overdose before you get help, that you can actually walk into a police station and we would get you help. I really thought at the very beginning that not many people would be walking into a police station asking for help. I was surprised to find out that there was a pretty good demand for it. What happens when you walk into a police station, there's some basic information that's taken by the police. Nobody's charged for any kind of crime whatsoever. Even if you bring your drugs in, nobody's charged with regard to it. And then what happens is that we then take it and have that person clinically evaluated. And once the clinician evaluates that individual's then actually that right then and there brought to detox, and then later after they complete detox, they're put into a treatment facility, and then eventually then go into sober living. They're kind of tracked. It's like a navigator that tracks them all through the different stages. The bottom line was this, where Ocean County had led the state in death rate for 4 years in a row. This past year we had a 25% decrease, the only county in the state of New Jersey that had a decrease in the death rate.